Today I'm going to talk about when and how often to use enemas, so stay tuned. Hey there, if you're new here, my name's Amanda Malachewski. I'm a certified functional nutrition health coach and a digestive and allergy detective. For tips and tricks on how to resolve your digestive challenges from their roots, please consider subscribing and be sure to hit the bell to be notified when I post a new video every week. Enemas have been used for thousands of years all over the world for their health benefits, but when and how often and for what should you use them? In today's video, I'm going to talk about the contraindications for enemas, so when you shouldn't use them. I'll talk about in what situations and circumstances you should use them, and I will also talk about a general recommendation for how often it's safe to use them. So let's get started. Let's start with contraindications because it's always a good idea to know when something isn't safe for you. So a lot of these are kind of obvious, but the first one would be if you've had recent bowel surgery or any kind of bowel obstruction. Obviously, these are situations where you don't want to be introducing the potential for any kind of infection or stretching into your large intestine. If you have active hemorrhoids, you probably also shouldn't use enemas because this can just aggravate them. If you have undiagnosed severe abdominal pain, you need to stop right now and go talk to your doctor and try and find out what's causing the pain before using something like enemas to try and clear it. If you have heart disease or uncontrolled hypertension, so high blood pressure, enemas also aren't a good idea because the loss of fluid from the enema can alter your electrolyte balance, and this can have consequences for your heart rhythms and for your blood pressure. And if you have either some kind of cancer or tumors in your bowels or intestines, this is also a pretty good reason to avoid inserting anything into your bowels. And there's probably some other situations in which enemas might not be recommended. So if you have any concern or doubt about whether or not enemas are safe for you, I do encourage you to please go speak with your doctor about it and get a clearance from them before using enemas. Now, assuming that you don't have any of these contraindications, then when should you use an enema? And the way I see it, there's kind of three main situations where enemas are really, really useful. Obviously, the first one is constipation. So constipation being when you have slow movement of your poop through your intestines and you may not poop regularly or on your own very often. Enemas are a traditional remedy for just helping assist that process and move things out of your intestine. It's crucially important that you poop every day because this process helps eliminate toxins and other things that your body is trying to get rid of. And obviously, it's no fun to have constipation. It hurts. You get bloated or have gas, maybe a little bit of mild abdominal pain or cramping, and even things like headaches and sometimes joint pain. So, we want to be moving poop through your intestine every single day. So enemas are one option for how to help you move things through your bowels and support this process of daily elimination for you if you're having trouble. The second situation where I might recommend enemas would be if someone is doing any kind of fasting. I don't recommend a lot of fasting for my clients because most of them tend not to tolerate it very well for various reasons. But if you're someone who's doing a multiple day fast of any kind, so a bone broth fast or a water fast or elemental diet fast or a juice fast, again, it's really important that you are clearing the toxins that your body might be releasing, and you might not need to poop as much because there might not be as much material in your intestines to poop. So during this short-term kind of 3 to 4 day fast window, you might do one low volume enema per day. The third situation where enemas can be helpful is during parasite treatment. And in this situation, you might be doing kind of a long-term strategy of periodic enemas while you're doing other treatments, or you can be adding additives into your enema to help kill parasites in your intestines. I did make another video where I go into this topic a little more thoroughly and with specifics, so if you'd like to see that, you can check out Parasite Home Remedies. I'll leave a link for that below this video. Okay, now one of the most common questions that I get about enemas is how often should I do them? Is it okay to do them daily? Is it okay to do them several times a week? Is it, people want to know what they should do. And it's really hard to give a really blanket general recommendation for this because each one of you is really different. Your situations are different. And so it's hard to give a really clear answer to this, but the thing that I would really recommend using as a guide for how often you should do enemas is to really think about how is your body responding. So, as I mentioned, I have done some long-term enema protocols over many months, and I was doing during this period, 2 to 3 enemas a week. Sometimes I would notice that I would start to feel really tired or a lack of energy and really hungry or maybe headachy. And that was a signal to me that I was doing too many enemas and I needed to drop back. So if you are doing enemas frequently and you start having some of these symptoms, that would be a signal from your body to say, slow down, you're doing too much. Because again, enemas really alter your electrolyte balance. So this can have something to do with headaches and blood pressure and your energy. And also, if food's moving through your gut too fast from doing enemas too frequently, you may not have enough residence time in there for you to absorb your nutrition from your food. So again, do listen to what your body's telling you. But in general, I would say maybe twice a week would be fine. Less is fine too. And if you tolerate it well, you could do even more than that. And certainly if an enema ever causes a pain sensation, you need to stop doing enemas right away and go see your doctor and find out what is causing the problem. One thing to know is that the day after your enema, you might not have a normal bowel movement. You might not poop at all. And this is because it might take some time for your guts to fill up all the way enough to have another bowel movement. But your bowel movements should return to normal the day after that. But if you're continuously unable to poop normally on your own, this is a pretty big sign that, some things need to change and you're going to need to do something bigger. And this might look like in the short term, things like enemas and, supplements like vitamin C or medications like laxatives, but these are really Band-Aid solutions. And so if you're having regular, consistent chronic constipation, this is something that you need to address. And some of the options available to look at that include changing your diet, changing some of your stress management habits, and sometimes it has to do with needing to deal with some sort of dysbiosis or SIBO or other kind of bacterial infection in your gut. So if that's your situation, please do not delay with dealing with this. There are things that can be done, and it's important that you get your motility back in your digestive system. How frequently do you use enemas and what do you use them for? Tell us all about it in the comments. Okay, so enemas are helpful for constipation, for fasting, and for parasite treatment. And a general rule of thumb is that 1 to 2 times a week should be safe, but do listen to your body to get feedback on how often is right for you. If you're needing help with chronic constipation, there's 2 main ways I can help you. The first is you can download a free copy of my mini ebook called The Roadmap to Gut Recovery. It includes the step-by-step process that I walk my clients through to manage and resolve things like chronic constipation or chronic diarrhea or other digestive symptoms. So you can grab your free copy of that by going to confluencenutrition.com/roadmap, and I will leave a link for that below this video. Or if you've been trying a lot of these options on your own and you're still not sure where to go or what to do next, you could schedule yourself a free 30-minute assessment session with me. In this session, I will sort of take stock of your case and try and understand what might be your next best steps. And then we can also talk about what it would be like to work with me one-on-one. You can schedule that by going to confluencenutrition.com/contact. And I will look forward to seeing you on my schedule. And I will also leave a link for that below this video. All right, I hope that this video helped you understand how to properly use enemas and how often might be safe for you. If you liked this video, please consider liking or subscribing to my channel and consider sharing it with somebody that might benefit from it. And I will look forward to seeing you next time. Take care.